Hello, everyone. This is Dr. Nadal over at Nature Cures Clinic in Portland, Oregon, with another episode of What the Health. And today we have the special honor of having Dr. Herman on the show. Dr. Herman, why don't you tell us a little bit about yourself?
Thank you for that great greeting, and thank you for having me on your podcast with your followers, your listeners. I love helping people get better from chronic disease. There's no greater pleasure than helping somebody who suffered from a chronic illness for whether it's a year or many years, helping to see them restore their health. So that's what I'm all about, and using natural methods. No medicine is used. It's all natural methods that are very unique to help people clear out the different causes, the root causes of their disease. So that's what I'm about. Now, I can get into how I started with this and how I grew into it, but that's basically what this is all about. Any chronic disease, I believe that there's an answer for it all.
Yeah, excellent. You're speaking my language. Yes. And there's so many labels, titles, ND, DO, MD. I mean, really, if the medicine works, let's just do it. Natural meds, otherwise, right? So yeah, get into that. Tell us what got you here and what made you passionate about this.
I started out, I'll tell you, when I was about 15 years old, my mother, she said, "You're going to school, doctor, dentist, lawyer, pick one." And I said, okay, well, I didn't really know. My brother hurt his back, and my older brother, we always worked out together. We were buddies growing up, and he hurt his back, and a chiropractor helped him be able to walk and move again. And anyway, we called that man a doctor, and just liked his lifestyle and seemed like casual at work. And I didn't really understand more about it, but that's what we chose because it seemed like the physical fitness, good, healthy way. I didn't have to see blood. I didn't cut people open with chiropractic. But I noticed quickly when I came out of chiropractic school that while I liked going to the chiropractor, not everybody did, number one. And number two, that chiropractic didn't take care of all that ails people, even though that's what the school's philosophy was. Everybody needs the chiropractic treatment. And it really opened my eyes that there were people who had different types of chronic conditions, whether it was fibromyalgia or Parkinson's or high blood pressure. They had neuropathy. They had digestive disorders, asthma. The list goes on. There's many chronic conditions that people suffer from. Lupus, MS, that chiropractic really wasn't the answer for it. And even as a piece of the puzzle, I don't even know if it was going to be effective as a piece of somebody's healthy lifestyle to try to help them function better. So I went back to school for functional neurology and studied all just the detail about the brain and just incredible about the nervous system. And they offered us courses in this postgraduate school for neurochemistry, which I took that as well, and neuroimmunology and endocrinology and GI disorders and thyroid disease and developmental disorders and movement, Parkinson's type of movement disorders. And I took all those courses. I just became this like the best student ever. I just wanted to know everything that I could about the body. And then cancer, I started seeing people's lives around me. Back in my early 30s, people's lives failed, to like people dying from lupus, who we knew for many years. A second grandfather, my grandfather had passed away when I was a little boy, but then she got married again, and then he developed Parkinson's. I came out of chiropractic school, and here he is with Parkinson's, and within 3 years of his diagnosis and the medicine and the best MDs, he passed away. It was terrible to see him pass. And then I saw somebody else who developed cancer, somebody I knew for many years, a good friend's mother. She had stomach cancer and went the medical route and the chemo, and that was all that she knew. And I didn't know any way to help her. And I thought I was learning a lot in postgraduate school, but she had passed away pretty quickly after the chemo and the surgery and the radiation. It didn't help her. And so I just had to learn more. I started taking other postgraduate courses about cancer, alternative cancer. I won't say a cancer therapy, but a body therapy to help the body overcome cancer or give it a better chance to overcome cancer. And dental work became my eyes and ears were open for everything and anything that I could grasp to be able to help a person overcome disease. So I took various courses about how the dental connection of teeth and disease in the body and the brain in the body, and not just the mercury fillings, but root canals. We could talk about that later if you want to go in there. But I'll tell you, in the immunology program that I took, it was very interesting because the immunologist who taught us in this program had revealed through so many different studies, research papers from laboratories around the world, where these scientists were not funded by drug companies. So it wasn't about the medicine was the cure for the disease. These scientists were looking at disease in a way of what would cause the disease. And every single research paper pointed out the same thing. There were chronic hidden infections, parasitic, viral, bacteria, mold, fungus, and even toxins like mercury or like anything can get into the pesticides. These different things can get in the body, many more toxins than what I just mentioned there. But there are many different causes of disease that was clear from these different research papers. And then I just had to know more and graduated into this that I'm doing now to, again, find the root cause and help the body eliminate it so we can see the person restore their health. And that's basically how it all came along over the past dozen or so years. Yeah.
Amazing. Okay. Yeah.
Wrap it all up.
Yeah. I mean, it's so interesting to me, like kind of the healer's journey, you know, everybody, because even personally, like, yeah, my dad, you know, had some back issues and I saw it improved with acupuncture. I was like, huh, okay, something there. I was in a similar sort of way gonna pursue quote unquote traditional conventional medicine. And then some family members, mom and aunt, got diagnosed with some serious autoimmune conditions. So seeing that around me, you know, going through pre-med, like switched a lot of things in my mind as far as what was working and what wasn't working. Then I had a friend out here in Portland who told me about this school for the naturopathic medicine. I'm like, what? That exists? There's more to this than. So yeah, I get it. I get the journey, and it's always inspiring. And I feel like after, you know, people like you and I like doing this work and actually seeing real changes happen, you know, I feel like we're doing our job and getting the word out there, and letting people know that there is hope and there is another way, right?
Mhm. Very good. Yeah. Yeah. The people have to know because there's, you know, unfortunately, what people believe or are, I don't know if I should use the word, they're programmed to believe from so much of the industry that's out there. It's just that medicine is their only chance of trying to overcome a symptom or cope with the symptom or manage it. And you're right, people deserve to know that there are other options out there to help them overcome a condition.
Yeah. And so tell me a little bit more about like what sounds like some of the more functional medicine, like uncovering these underlying causes. Because, you know, even if you go to the best rheumatologists out there, like, you know, there'll be some blood work, maybe some imaging, but all the things that you were talking about, like kind of dormant, you know, viral infections or even environmental toxicities, there's so much out there.
Mhm.
So what are some of the ones that you look for first?
Of the different types of infections or toxins, is that what you're at? What do I look for first?
Sure. Yeah.
Well, let me start out with that. In my history, because I went with that functional medicine route for a
Mhm.
while. That was what it was offered in that all that postgraduate, all those courses that I was taking at the time. They were talking the functional medicine way of evaluating the body, as well as a whole complete, very long, lengthy diagnostic neurological evaluation.
Mhm.
And there were people who when we ran all these different functional medicine type of labs, it all sounded functionally good to me to be able to get that type of evaluation, but there were things missing still, and I just couldn't understand. I just didn't understand what it was at the time. I do now. I able to help many more people now, and there were people who got better with that functional medicine and neurology route, but there were and various supplements and taking away gluten and dairy and all that. But I just realized that when somebody, let's say, had numbness in their body, and I ran a stool test and I ran an adrenal hormone test, or I ran a upper and lower GI study, and I ran a food sensitivity panel, and there were no infections in the colon, there was no infections in the poop, there was no adrenals were okay, they were a little bit out of order or a lot out of order. And the food sensitivity panel said stay away from, you know, chicken or stay away from gluten. People would follow these recommendations, but still not get better. And
Mhm.
even looking at a whole neurological exam still would not get better. So, and I ran genetic testing on people. I was running and even in a blood test, just let me get to the point. The functional medicine for me, it wasn't working as good as how it was so seemingly logically presented to me in these courses. And I can explain things in a seemingly logical manner to a person, the way it sounded good for them to understand. And people were programmed to wanting these different laboratories to find out about their body. But there was still, again, what I just said before, there was still so much missing from evaluating them. So Some people did get better with that, but there was not enough of a percentage of people improving with those steps. And even some people who did get better with those steps early on, going back several years ago, I'm talking like 10 or so years ago, where I left that behind. There were some people who did get better, but once they went off the diet or once they stopped using the supplement, that improvement just disappeared or decreased in the level of improvement that they had experienced with that diet and with the supplements. So to me, it wasn't good enough. I had to find another way, and which is what I do now. But what do I find most of what your question was? Just everything. I'll tell you, there are people who come to my clinic with different conditions, whether it's a chronic migraine headache or chronic fatigue, or they have pain in the body, and I'll see a lab that their physician had run on them prior to them coming here, and the doctor had said, well, that was a dormant Epstein-Barr virus, or that was a dormant influenza virus, or well, the candida that's in their blood is not really the main cause of the problem, is what their doctor had told them. Not all doctors, I'm just saying a few, just a handful of people that I can, recall some of these statements from. And my question is, how does the doctor know it's dormant? There's no way to read the blood test to know it's dormant, or even know if it is or isn't causing the main or one of the main causes of their condition from looking at a blood test or looking at a hair analysis or a urine test or so on. So what do I find? I find just everything. I'll tell you, there's multiple viruses that are around that are hurting people, causing various symptoms. There's mercury. I find dental anesthesia chemicals that are hurting people, that's gotten into the brain and stayed in the brain, even though the mouth numbness, that whole numbness in the mouth wore off. That chemical went from the mouth, or went up into the brain, or went to the thyroid, or went to the kidney, and it's causing other symptoms in a person. The anesthesia chemicals used in surgeries, the sedatives, even medications that people have taken pollute the tissues. And there's such a long list about toxins. It's too many to mention. But infections, there's just so much. There's so many. There's so many viruses and so many bacteria and molds and mold toxins and fungi that invade the body, parasites that invade the body, bacteria that invade the body, that there's a long, long list. There's a long list of, and where they can inhabit the tissues in the body and just cause these terrible diseases that are often missed. If we looked at a blood test or a stool test or a food sensitivity panel for, let's say somebody's got headaches and there's nothing wrong. Generally speaking, there's nothing wrong in those different tests, but it was all caused by, let's say there was a influenza virus in the brain or an Epstein-Barr virus in the brain. We're not going to know that from running a hair analysis or a blood test, basically. So
it's true. And then kind of to reframe or open it up then. So given what I agree, there's, even though it's on paper, it makes sense and so much logic, it's like its own system, but then what? What did you come to discover or find? What were these missing pieces that have informed your approach currently?
is that what do I do now? How do I?
Yeah.
I'll tell you, I thought, let me just go with this. Many years ago when I was in chiropractic school, when people were talking about muscle testing, I was like, that's kind of a joke. I don't know, what are those people doing there? And years later, when I took this postgraduate course in alternative cancer type of a treatment for the person's body, somebody did a muscle test on me and I was blown away. I just never had felt that weakness that had happened in my body from a certain test strategy. And so I started taking different courses in that and Chinese medicine and further, I'll just tell you that the more and more I studied Lyme disease and other types of ailments in people, the more precise I realized that the exam had to be. So this work now that I'm doing, which biophysicists had discovered, there's an energy about, and you do acupuncture, right? So, that's around for over 2,000 years, and obviously it works. It's still around, and people get better with that. And so it's understanding the energy flow of different tissues. It's understanding the frequency of these different tissues and literally being able to tap into that tissue and find what's the disease-causing infection that got into that tissue and using a specific remedy that will get that disease-causing infection or chemical out of that specific tissue. Like, for example, if the thyroid has dental anesthesia chemical in it, we have to be able to find that, and that's what's slowing the thyroid down. The anesthesia got in there. We have to be able to get the anesthesia chemical out of the thyroid and know that we're getting it out and getting that anesthetic out of the whole body. So that's what I'm able to find with this work and provide that person that safe and effective remedy or formula that's going to get that exact specific frequency of that chemical out of the thyroid, for example, help improve that thyroid function.
Yeah. And with these remedies, I guess we'll get into that. And then so your form of applied kinesiology and all this more advanced training with bioenergetics ultimately is what informed a lot of the current approach. Is that accurate?
Yeah, basically. Yeah, basically. And I mean, it goes a bit deeper, but that's everything. Listen, even with a muscle test, you know, if we look at from a neurological test, or if you went to a neurologist or you went to an optometrist, most people have had their eyes tested before. The doctor shines a light in the pupil, and we see the pupil reflex, the constriction of the pupil occurs. Well, the pupil is just a black hole that lets light into the eye and into the brain. The brown or the green or the blue or the hazel part of the eye, the iris, there's muscle fibers there. So when we shine the light that goes in the pupil, that light stresses the eye and stresses the brain, and the brain's response is to send a signal through a nerve to the muscles in the iris, and those muscles flex and they make the pupil smaller. Keep the light there, that muscle response is still happening. Take the light away, the muscle response disappears and the muscle relaxes. So a pupil exam is literally a pupil reflex test, is literally a nerve muscle response, just like any other thing that we can do with a muscle test. So when people understand that, you know, because they're familiar with a knee jerk or a pupil reflex, they know that they're familiar with, that is still the nerve to muscle response, as I just said a minute ago. And so any type of muscle test that we're doing is really that nerve to muscle response to see a stressor, and where we could take away the stressor from the body. So yeah, it's just that this has become so advanced because I figured out various ways of, by using my studies in neurology and other areas of study, to be able to understand how to find if the body's stressed by a certain function, like taking a deep breath may cause a person to stress, even if they're not an asthmatic, or they don't have emphysema, or they're not short of breath. And so a breathing strategy I can do can find if the person is weak in their kidney or in their stomach or in their brain or in their thyroid, for example, and we can find why. So every time they're taking a deep breath, it's making their body weak and they don't realize it. Everybody needs oxygen. Don't stop breathing. But that breathing mechanism, for example, can make a person weak, and that would be caused by a certain infection that's in a part of the body. And we can find that with that step and then get rid of that infection, and then they're no longer weak when they're breathing in, for example. And there's many, 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 many other exam steps that I developed in this method that I've literally, this exam process that I've created to be able to figure this out. So that's, I forgot what you had said before that got me rambling in that direction, but that's basically it. We're able to do all different types of exams, strategies to find the weak point in the body and get rid of that weak point, because the body's the sum of all of its parts, right? So when we can rid those infections that are wearing down and the toxins that are in the tissues that are wearing down those different tissues, we see the life come back to the person for many different conditions. I mean, from asthma to even tremors to just yesterday, a woman who she's in a wheelchair, 32 years old, not because she's paralyzed, but just standing up, a crushing pain in the chest would occur. She couldn't even breathe standing up.
Wow.
And right there on the diaphragm, which I found, and on the nerve, the phrenic nerve that goes to the diaphragm, I found infection. I found viral infection. So we provided her the remedy. I'm telling you right away, the abdominal pain within 20 minutes disappeared. And by this morning, I had a message from her husband this morning, a text message came in that her breathing had improved by 30%. She was already not that short of breath from that one specific targeted remedy to the nerve and to the diaphragm. Pretty incredible. So
that's brilliant. That's brilliant. And you know, a lot of what you're saying just it makes a lot of sense. I mean, even rethinking the way that, you know, the scientific method or modern medicine, you know, we've gotten so hung up on, you know, more cellular molecular biology, focusing on the cell, just the cell and everything in it, and then the genetics, and all that's really important. But really, you can't, to find the emergent property of the person, of the human being, we need to remember the other levels and orders of operation, like tissue specific or organ specific, because really a lot of pathology arises out of just different depolarizations and changes in the way the cells are communicating organ to organ. So it's kind of a call to arms, you know, not just focusing on more pathogenesis. But even if we want to toy with the idea of like salutogenesis, or like, okay, we're going to deal with whatever pathology, but we also need to exalt or bring up the person's innate ability to heal, right?
Mhm.
And tapping into the organ specific or tissue specific dysfunctions can reveal that. So I really do appreciate what you're saying, and it makes a lot of sense. And I think it's the direction that medicine needs to go in, for
Sure.
sure.
Yeah.
Yeah. Okay. And then so let's see, some fun questions about this. I mean, is it fair to ask what causes autoimmune disorders, or is that too big of a?
No, that's great. I'll tell you what I believe is it's all a few things. One is infections. Two is toxins. Three, I'll say that when the body's inflamed from these infections and toxins, the body will now activate mast cell activation syndrome. And those mast cells that are activated, they were once friendly to the body, they now became traitors to the body. So these activated mast cells are releasing inflammatory toxins into the tissues that further break down the tissue function, inflame the tissue. And then from what I've also found in my studies is that there are inflammatory proteins that the body will also develop these proteins that cause further inflammation. These inflammatory proteins were caused by inflammation, our response to the inflammation. So it becomes a terrible vicious cycle. There are certain things that can cause the problem as well, besides the infections and toxins and activated mast cells and the proteins, is that traumas, a traumatic brain injury. I notice on your website you deal with that as well. So traumatic brain injury can just like, if we can just say, jar up the brain, it's shaking it around, so to speak. And some people much worse than others. I believe that with a traumatic brain injury, that there's a ripple effect, whether it's a traumatic brain injury or any part of the body, therefore. I mean, you can fall and just like, terribly hurt your knee or fall on your elbow, or maybe somebody fell out of a tree as a kid and landed on their butt really hard. And there's a ripple effect, like dropping a pebble in the water ripples away from the center where you drop that pebble. The trauma site on the body ripples, and energy ripples away from that trauma site and can now distort other organ function. And can actually, what I believe is that from the research that I've done is that with epigenetics, about not the genetic theory, but about the environment that changes the way the cell functions, that I believe that there are dormant viruses, because we have the human microbiome, we have the virome, we have viruses that are part of our DNA. So we can have a dormant, let's say Epstein-Barr virus that we were born with, that can now be triggered, that was in the brain and on the heart, and that trauma from falling out of the tree as a kid, landing on your butt pretty hard, nothing broke, but that can ripple the energy distortion into the heart and into the brain and turn that Epstein-Barr on. So that's a big part of it as well. And then emotions, the final part I'll say is emotions will also trigger problems. So there are people who are sexually traumatized. I mean, they were molested, unfortunately. That terrible situation occurs to little boys and girls, that people can be molested. There are others who are, without getting too negative in this discussion, but about, rape. And there are others that are just emotional stress, between parents to kids, or between adult, and a boyfriend, girlfriend, or adult, spouse to spouse. There could be terrible emotional abuse, or even people who've had a family member who died or a pet died. I find that these emotional traumas also will trigger dormant viruses and even maybe activate the mast cells and cause these different inflammatory stresses. So my point of view, autoimmune disease, to wrap it all up, is that autoimmune disease is triggered by these different toxins and infections and the activated mast cell and so on. Everything that I just said, emotions, all of that is part of it. I don't believe that the body just attacked itself. I don't believe that the immune system just went crazy and started attacking its own tissues and caused the diabetes or caused a thyroid disorder or caused rheumatoid arthritis. There's a lot of research that I found online that pointed out that parasitic infections and bacterial infections actually cause the rheumatoid arthritis. There's a ton of research about how people who had normal function went on a vacation, and all of a sudden they started getting dizzy and developed shaking or tremor-like disorder. These people in another country had a spinal tap. Doctors did a spinal tap and found dengue fever virus in their spinal fluid, found St. Louis encephalitis virus in the spinal fluid. the people were able to find back in their history on that vacation. They were fine before they went, but then they were in somewhere where they got a bunch of different mosquito bites, and they linked the mosquito bite to the dengue fever or the St. Louis encephalitis virus that then caused the whole balance disorder and the whole Parkinson's-like presentation while they were on vacation. So there's a lot of different possible links to it, but I don't believe that the body just attacks itself. I believe that where the immune system is doing what it's programmed to do, that it's going to attack the infection that's on the part of the body where it found the infection. So if there's a mold, like in a drywall, the mold became part of the drywall. We cut out that drywall where the mold is. Well, the mold that's on the thyroid, for example, we can't just go in and cut out well, they could, but I disagree with that. But the mold became part of the thyroid, like infused into it, grew into the thyroid gland, the mold. What the immune system is doing, what it's programmed to do, is to protect us from the mold. But the mold and the thyroid actually became like one. And the body doesn't have a way of getting the mold out to uproot it without a certain kind of technology, like what I do. So I believe a Hashimoto's or Graves' disease can happen from that, where the immune system is attacking the gland where the mold is in the gland. So, and that can happen anywhere in the body, whether it's lupus or MS and so on. So that's the point of view that I follow, is clean up the body and then let the body just restore itself, and it can calm down that whole autoimmune response. What is your thought?
I think it's pretty much very similar to what you're saying. I mean, it's basically the perfect storm. I mean, it could be more, like you were pointing out, latent infections, but trauma and emotions. I mean, in some ways, that dysregulation of self versus non-self of the immune system, what better metaphor or analogy to, like, if there is a traumatic experience from another, you know what I mean? So it does trickle down to a combination of these things, I think. In other words, I think it would be hard to find anyone, even with a variety of infections, that hadn't had some type of deep trauma when they present with some autoimmune condition. I think it is pretty prevalent, so I agree with you. And then that begs the other question, like, can people really heal from these severe chronic diseases or autoimmune conditions?
I will tell you, I can give you a few examples. So the answer is yes. Okay. And whether, well, let's just stay with the topic you said, autoimmune disease. I have video footage of a patient of mine who we haven't, unfortunately, been able to continue to work with her. She had MS for, I think her legs didn't work for 5 or 8 years. She had MS, and right around that whole lockdown period of time with the COVID, all the news, and they shut down the country, couldn't get in, couldn't go out, basically. So still from Canada to down here in the US, she hasn't been able to get in here for this work, but I've got video footage of her not being able to move her legs for several years and being able to move her legs after, I think that was after about 3 treatments with us, able to actually extend her legs out, kick her legs out. They couldn't move before for years. She had vision restored for a short period of time. She had lost her vision restored, short period of time. And that was happening towards the end of last that I saw her, before the whole COVID lockdown time. She had incontinence, total bladder loss of control. She regained that quickly, very quickly. By the first and second treatment, that was all fixed. She had a freezing feeling, numbness from the neck down of her whole body, as well as freezing in the hands and the feet. The freezing disappeared, the numbness disappeared. She had full sensation come back. Now, there's a woman who had more than 30 lesions, multiple sclerosis lesions in the brain. So how did she, if it's not possible to restore function and normal sensation, how all of a sudden this take place for her? So it is possible. I have another patient who had Hashimoto's diagnosis. We have a before and after ultrasound, and in the after ultrasound, besides her testimonial of how much better symptom reduction was amazing for her, and she had been on thyroid meds before I ever met her. So it wasn't that we raised her. We didn't do anything about a thyroid medication, getting rid of the causes of her condition, and helped her get better. And the post-treatment ultrasound study showed that the MD who read her thyroid ultrasound said there's no active form of Hashimoto's on this thyroid, is basically what it says. I don't remember verbatim, but that's basically what it says. No active form of Hashimoto's on the thyroid at that time. I've had people with lupus, terrible rashes on their body that they call the lupus rash, just disappeared with this work. We've got video footage of that, before and after pictures of that. And I'll tell you, outside of the autoimmune disease, even rheumatoid arthritis, I've seen people with their pain disappear with this work. Outside of that, we've got one of my great pride right now is the congestive heart failure. I've got a patient in her 70s who comes here with her husband. They're both patients, and she had congestive heart failure diagnosis since 2008. And so 14 years of that. And they did a heart surgery, ablation to the heart to try to make it run normally. It never fixed it. Got better, slightly better. Then it reversed back to what it was prior to the ablation. She had stem cell treatment. She got some improvement, but never perfect. And after 2 treatments here, they can't find a congestive heart failure diagnosis with her anymore. The heart's injecting normal blood, normal amount of blood, and all the AFib totally disappeared. She had a Holter monitor for a month. They can't find a problem with it. They said that she doesn't have it anymore. They said she doesn't have to come back and get tested for 5 years. So, and that was after getting tested, I think it was every 6 months for 14 years. So pretty awesome. And there's many more.
That's huge. That's great.
Yeah.
Wow. So you
Thank
really
you.
do stuff every day. Good, nice work.
Yeah, thank you.
So, I mean, some of the other questions like, what do you do when traditional medicine falls? It's like, well, you explore other avenues such as these, right? I mean, and then your method, your approach, like, I guess if you want to share, like, are you refining this? Have you written, some material on it? Are you training other doctors in this? Like what?
I haven't, I've thought about training others. I didn't create making a remedy. I didn't create the samples I have. I did create the whole system of how I'm analyzing the body though.
Yeah.
And that just keeps on developing and developing and developing. I love every time I think that I figured it out, there's always a new message, a new something I discover with it. So got to stay humble and realize that there's always more to learn. And with that makes life more of a fun journey. I haven't written anything. We created a very extensive website about this, my website. I did write a free book that people can download that's on my website, where it gets more into some of the detailed background behind this work. I did, talking more about the method, I'll tell you, it can take me a pretty long time to describe, to get people to understand. Everybody's at a different level of understanding or being able to appreciate what I'm saying when I try to get them to understand it. You might pick it up quicker than some others, than other people, but it's in some consultations in the past, it would take me over an hour to literally describe it to people and to get them to start to grasp what it is that I'm doing before they ever showed up in the clinic, so that they could be aware of what we're going to do when we get here and how it's going to work. So what I did was I made a 42-minute video. It wasn't supposed to be 42 minutes. It just turned out to be 42 minutes. But that video that I produced, that's on my website, that's on the very last page of that free ebook that's on my website. That page has a link that people can click on, and it takes them to a private page of my website. And on that page on the website, they watch this video that turned out to be about 42 minutes. It's probably about a 5-year-old video at this point. Or maybe I should remake it. But I talk about my background and the functional medicine journey and all the other schooling I went through. And then for the second half of that video, I talk about the somewhat into the how basically this works. I don't get too much deep detail into exactly all the steps I take, because for some people who come to me with brain fog or have learning disability, or just people who are just so ill they can't even concentrate on anything because the pain is so terrible for them and their illness is so terrible for them, they just don't have that much brain space to listen to the whole presentation. So with that said, there is enough there, I think, to help people get a bit of insight to how I'm doing it and what I'm doing. So I could go on a very long discussion. I just don't know if your listeners want to, sit for the next hour of me describing it. Yeah.
Yeah, no, and if you already have it out there, that's we can just share how to find that. If any more detail, like on your website left, like, yeah, we can just, what is your website? So
It's my name. So Dr. DR for doctor, not the whole word doctor, but DR, www.dr. My name, LONNIE, Herman, HERMAN. So Dr. Lonnie Herman.com. Simple.
great, great.
Yeah.
Just share it with our listeners. Yeah, because if it's there, we don't need to, yeah. But I do appreciate it. And it's fascinating. And I mean, I'm gonna check it out.
Thank you.
Yeah. And so when you mention remedies, and we don't have to, yeah, is it more, because there's like spagyrics, there's homeopathy, there's infoceuticals, like there's so much out there and it's quickly evolving. Can you share a little bit about like some of the remedies that you use?
Yeah, it's actually, so everything is frequency based, and everything is in the world, basically. I mean, if we look at, just to make a side point, about even going to like the chemistry table, you look at lead and gold. I mean, they're two totally different substances, right? So there's different energy properties of everything, whether it's oil and water don't mix, they're two totally different properties. Scientists, biophysicists measure that every single thing on the planet has its own individual frequency. When a person thinks of one person's aura, their energy, and another person, two men, same age, same, gender, race, religion, they can be similar, and yet there's a different energy about people. Well, these scientists found there's different energies about the organs. The thyroid gland is named thyroid. It makes hormones, just like the prostate in a man makes hormones. Two different parts of the body, two different glands. They're both making hormones, but they have their own different purpose and their own, even though part of the sum of the whole body, of course. Yet the thyroid and the prostate, these scientists, these biophysicists measure that they have their own frequency, individual. The heart has its own different frequency than the kidney, right? So different tissues, your bone marrow is not your lymph, and I can go on a long list. I think people get the idea already. So these scientists measure that they have their own frequencies, as well as if you look at a virus like Epstein-Barr virus is not influenza virus. Influenza is not herpes zoster. Herpes zoster is not Coxsackie virus. And so these different organisms have their own individual frequency, right? Influenza and herpes are viruses, and they're under that umbrella, that family, but they have their own individual frequencies. Well, what they discovered, and this is back, which I show in the book, and I show an example, because there's a video that people can look up on YouTube called Water's Memory.
Mm.
You know about that at all? Have you
Yes.
heard? Even Dr. Emoto with the love and hate and evil and how we showed that in the water. I don't know if you're aware. Okay, so what these scientists discovered is that we can actually program water. And now the water can be the, if you will, the medicine for the body. So it's not, doesn't mean just drink, good, healthy, clean water. Of course, that's very important. Yet the water, besides the emotion in the water can now be programmed to carry the frequency of the healthy kidney and the frequency of the lead that we found in the kidney. So now that remedy is the water that's holding the frequency of the kidney at a certain potency or strength level that the body needs to help get the lead out of there. So it's a kidney and lead remedy that when they take this liquid drop, it's going to go help the body. The frequency matches the frequency. So it's going to go to the kidney and help the body get rid of the lead from the kidney. If it was, let's say, streptococcus bacteria in the tonsils, it's a tonsil frequency in the water, and it's a strep bacteria, also a tonsil and a strep remedy that at a certain potency level. So when they take that drop of that liquid, it's going to go right to that thyroid and help the body get rid of that strep that's on the thyroid. It won't treat Epstein-Barr directly if it's not an Epstein-Barr remedy. It won't treat the heart if it's not directly to that. Does that make sense how I describe that?
Yeah.
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 So
Perfect.
we have a series of different remedies that we create in a protocol that may be a 2-month or 3-month or 4-month or just a 2-week protocol. It depends on what it is with the person or dog. I treat my dogs. And so I've treated other people's pets, but the protocol, when we can follow up with the person, and sometimes these different chronic ailments, like what you brought up, different autoimmune diseases, sometimes they're not just the easy quick fix. I mean, it may take months before we can see a change in the person, to see an improvement. Yet I have figured out a way as well. When I do the exam on a person, I can, when I re-examine them and I look at my notes from their previous exam, we can find that, let's say, the stomach, there were 10 different parasites there that we targeted with the remedies. We see those parasites are gone in the follow-up exam. We can tell that. We could see the mercury left the brain. We could see the influenza that was on the heart is gone, basically, from the heart. So we can follow up and tell that took place. And sometimes the improvements after one protocol, they're going to be pretty small, but sometimes they're just so amazing. Sometimes they're just, it's almost mind-boggling at how rapid the body can heal. So that's basically it. It's the frequency-based remedy. We're using clean, pure water that we program with these machines that we have.
Awesome. Okay. Wow.
So I have all different samples in vials here. I have all different samples of different parts of the body, whether it's the skin, the bone marrow, the stem cells, the embryo stem cells, the lymph nodes, the ovaries, the prostate, the testicle, the mitral valve on the heart. I can get really, I mean, the gums, the tongue, go all the way down the line from head to toe. We have samples of all those, and we have samples of all different types of Number one, I have frequencies of the different organisms and chemicals, but also I have a lot of different, over the years, it's been, right now, I've been accumulating different samples for about 12 years. So I have different types of anesthetics that I got through anesthesiologists and different certain vaccines from pharmacists, and the recent ones, by the way,
Mhm.
shouldn't be talking about. But also, right, but also different drugs that people have taken. I mean, I have found, there was one woman who came into my clinic who had, and I believe that this sample I got from a patient was actually truly, it was a street drug, cocaine, that she said that she had used, and these terrible, terrible, like violent migraines. She was nauseous. She couldn't stand up. Young, in her 40s, couldn't stand up. She was heart palpitation. Somebody had to carry her in the clinic. She was writhing around in pain on the table. I found it was cocaine in the brain. And that was the actual, whatever the white powder is, that was in the sample that was given to me to use with this. She took that remedy, all of the nausea, all the vomiting, all the migraines, the whole thing just disappeared. It was that what was in the brain. That was it. And that was pretty amazing. That was fast. Again, it can take it for another person with a migraine headache. It could be a whole nother series of different infections and toxins that made it happen. That's not that fast. I mean, with her, it was 1 week, all the migraines were gone and never came back. And the nausea disappeared and light sensitivity disappeared and all that. So, but I've got a lot of different, again, parts of the body and different infections and toxins. We can find anything. Excuse me, anything. We had a child here, excuse me. Sorry for that. We had a mother brought her baby in, 18 months old. She first brought her here to my clinic back when she was 6 months old. They live in Louisiana. And she came to the clinic referred by another family member. After medicine couldn't help her baby, the baby had, at 6 months old, she had a rash on her face and on her chest. And it took 2 treatments. All the rash disappeared, completely gone. And then we get a call. She's 18 months old now, the little girl. And the mother says, I've got to see you. I've got to get in as quickly as possible. My daughter, she's acting really strange. I think she has autism. I said over the phone, did she have a vaccine? No vaccine. I never vaccinated my child. I said, well, okay, come on down. They come here to my clinic. The little girl, 18 months old, mother's holding her on her lap and the baby's banging her head against the mother's chest. Mother puts her down. The baby's banging her head against the desk, against the chair. She doesn't stop banging her head, clinging to the mother with anxiety. She's pulling her hair out of her head. She's screaming, doesn't want anybody near her. She went from being a calm, quiet, friendly little girl. All of a sudden, one day, switch flipped and she became this autistic type of stressful presentation. And the only person who can keep her somewhat calm was the mother. And so even nobody ever, the family's been fine. Nobody ever did anything wrong to a little girl. But the girl would not let her father near her, screaming and screaming and screaming, only the mother. So for a month, insomnia for the mother because the baby wouldn't calm down, and screaming and crying and pulling her hair and banging her head. And no exaggeration, it was very difficult to examine here because the girl was just out of control, screaming so loud and nonstop, couldn't even stop to take a breath. The girl was red from head to toe from all the lack of breathing. She was choking on her own screaming. It was terrible. And I found in my history taking with her that she had an ear infection a month prior, or about 6 weeks prior to her coming here. She had an ear infection, had a fever. Mother brings her to the hospital. And they gave her an antibiotic. Now they pinned her down on the table to draw blood. I'm thinking there was a post-traumatic stress, possibly because the little girl was just freaking out in the hospital when the doctor and the nurse pinned her down to draw her blood. The girl didn't like that, but they give her this antibiotic. The next day, the fever is gone and the ear infection symptoms are gone, but she starts banging her head and pulling her hair and not letting anybody near her but her mother. And so we found with her that antibiotic, which I had the exact pill in the clinic here in a sample that I have, we found that antibiotic in the exam in the frontal lobe of her brain, because I can get that specific. And so the girl was so out of control. I just had to stop the exam because she was screaming nonstop. And I thought she was choking on herself. She couldn't even stop. She couldn't stop screaming and she couldn't get a breath in. And she was red. When I mean red, like your shirt color was her face and her body was like that.
Wow.
And so no exaggeration. And so it took about 10 minutes to make this remedy. And the mother gives her the remedy. And within, I don't know, I didn't have a stopwatch on to time this. It was maybe 2 minutes, maybe, after giving her this remedy. The little girl sits up. She stops screaming. She smiles at us, reaches out to my wife, who's here in the room with me during exams. The people reaches out, high five, and she just starts laughing. Stops banging her head, stops pulling her head. The whole thing disappeared that fast.
Wow.
So it can be that great, but I'll tell you, there are other times that it's a whole long journey. But that can be. So yeah, so again, back to your question, how we do it, we've got the samples of the parts of the brain and the body, and we have these different infections and chemicals, and just getting better all the time to find out what's causing the ailment in the person. Because the only thing that matters to me and us and my whole team, the only thing that matters is getting a person better. We've got to be able to get the answer, and I've got to, and probably a lot like you, I've got to see that person get better from this work. That's the only way I can feel satisfied. Going home and looking in the mirror is like, I did my job today. I got that person. I was able to make that improvement. And when it doesn't happen that quick, because it got to be humble, there's always something to learn. Is that it just drives me harder to figure it out. So
yeah, you got to keep inspired and motivated, and you're right, it's humbling, but we always got to stay curious. We're artists, we're healers, but as physicians, we're also scientists, right? So that always keeping that questioning mind, it's what keeps us going, for sure.
great point.
Wow.
Thank you.
No, thank you.
Letting me share all that.
Yeah, that was amazing and inspiring. So many different styles of medicine out there, but it sounds like you've gathered the best of what's worked for you, and discarded what hasn't worked, and now you're just trailblazing in this way. So it's awesome to talk about it.
Thank you.
Yeah. Anything else you think that that our listeners or patients would want to know about you or otherwise? I mean,
I don't know. It's just been a pleasure right now to be interviewed or share this with you. And because I looked over your website, and I think we have like minds that, it's all about the natural, the body's ability to, and having the physician, the scientist mind to be able to tap into that person's body and be able to help them overcome a condition. And I haven't read your book yet. I'll get it and review. But I think we're like minds, and I appreciate you giving me this opportunity to share with everybody, all of your followers who are looking for answers. And for what I've seen on your website, I think you're doing a great job. And
thank you.
You're definitely, I don't know everything, but I'll tell you that from what I saw, that I believe we are on the right side of the health. And listen, medicine, let me not take it away from medicine, because if somebody had a heart attack, I'm not the person to help them right away.
Right.
I'm like, there's a place and time, right? So, and I'm not the one who's resetting the bone. And I love the orthopedist, and I love the cardiologist who saved my mother's life, who did the open heart surgery on her many years ago, which taught me a lesson though, about going and exploring more about the body when I saw her have a heart attack. But I appreciate, being able to share this with you, because I know people who obviously, what I've seen on your website, people who are coming to you are on that side of nature. The body can heal. The body, with the right tools used, the body can heal itself. And I think you're doing great work. And I appreciate this time to be able to share this with you and your listeners.
Oh, thank you, Dr. Herman. I really appreciate that. Yeah. And then besides your website, anywhere else that people can find you?
Yeah, I've got my YouTube channel, and I've got my Instagram page and Facebook page. So if they just look up on the website, when they go to the website, they can scroll down like near the bottom of the homepage, and every other page, therefore, we've got videos that are linked to my YouTube channel. So that's an easy way for them to click on and find my YouTube channel. But they can just type in my name and look up Dr. Lonnie. I guess that's a way to look me up on YouTube. But again, on Instagram is at Dr. Herman Talks. And on Facebook is my name, Dr. Lonnie Herman.
Okay.
Yeah.
Thank you. Thank you. Well, there we have it, everyone. That was fascinating and inspiring for me to hear. Please feel free to share any comments or questions with us. It was a pleasure to have you on the show, Dr. Herman. Hopefully we can talk again soon.
Absolutely.
Yeah, this was a lot of fun. And yeah, till next time, stay tuned for next week's What the Health. Take care, everyone.